So to me, as a public health physician, it's all about prevention, prevention, prevention. We can either get immunized or we have to continue to fight outbreaks in our community amongst mostly now going to be unvaccinated or vulnerable populations. My preference, 100 times in a row, will always be to have the maximum immunization rate so that we can get our society back to as normal as can be and reduce the fear of this virus. The modeling, though, tells us that once we're at around 90% of the population immunized, eligible population immunized, that the risk of Delta, which is much more infectious than the other strains, will be less for us. I am concerned monitoring Delta's activity across the southern United States, across the UK and elsewhere, of its potential rise in the fall. And it would rise and spread mainly in unvaccinated groups. So as I said earlier, we have around 4 million plus individuals who haven't taken benefit of the vaccine to date. 1.5 million at least can't get vaccinated because of their age. So the call today was really for that 2.4 million individuals to come forward and get immunized. The highest rate we have will allow our society to return to a more normal state, a post-pandemic era, with less fear, because there'll be less risk of the virus spreading in our communities, spreading to vulnerable populations, spreading in long-term care facilities, or overwhelming our health system. So to me, the way we combat fear is by having the best level of protection and prevention of COVID-19 in our communities, and then people will see that the virus just can't spread when we have high immunization rates. It can't interfere with our children returning to school or colleges or universities or in our workplace, and won't cause harm in our hospital system by backing up our intensive care units. If we remain at around 20% of the population unvaccinated, we won't build a community immunity, and you'll get breakthrough infections in those individuals that are vaccinated, because not all individuals, especially those that are elderly or vulnerable or immune suppressed and or are receiving dialysis, for example, will get full protection of the vaccine. So the higher the proportion of our population immunized, the less we'll have to worry about those vulnerable people getting COVID despite getting vaccinated. So that is the concern, that unvaccinated still pose a risk because we haven't built enough community immunity against the virus, and it would cause breakthrough infections. But I'm confident from the modeling that I've seen that if we can achieve a higher rate of infection heading into September, like in the high 80s, 90s, then the fear of this virus will diminish. Its ability to spread in our communities will diminish. Its ability to interfere with our life and lifestyles will diminish, and we can get back to normal. That's why the call is today, and has been for the last 3 times I've spoken, to get immunized. It's our way out of this pandemic.